An OFR is a overdose fatality review, which sounds like it's just a meeting, but there's way more to an overdose fatality review. It's a team of multidisciplinary partners that come together to review fatal overdoses. So those are frontline practitioners that come together to share what they know about an individual that has overdosed, to really put together this really deep picture of what's going on with overdose fatalities, with the intention of developing recommendations for prevention and intervention that are actionable.
I think when people think about an OFR, they think that it's simply reviewing the case of someone who's lost their life to an overdose, but it's much more than that. It's the partnerships and the representation around the table. It's the work that comes out of OFRs with recommendations. But I think that it's this incredible safe space that partners can come together and be real with one another and talk about how as a community we can do better work.
The goal of an overdose fatality review team is to really look at the gaps in services and how we as a community can help people who have substance use disorder really figure out what things they need and what issues that our communities are seeing that we may not know. But through that overdose fatality review meeting, we discover, oh, hey, our jail could use a treatment center within the jail. Things like that. You know, I deal with people in the treatment community all the time, but having those connections to the Department of Child Services, the coroner's office, and the other agencies that are involved, you know, we're just a phone call away. And if I have a question, I can call them because we have that personal relationship because of that overdose fatality review. So those relationships are really powerful and really help every agency that's involved in the program.
You have everything from public health representatives to emergency department and hospital representatives, law enforcement, medical examiners, coroners. So there's a very broad range of stakeholders involved with this. I think the other piece of what's important with the collaboration in an OFR is that when these stakeholders get together, they form relationships that then go outside of the OFR meeting. And I've seen this time and time again, where conversations continue, new partnerships are formed, new collaborations happen outside of this, new efforts and new programs start to happen outside of this as well. I don't think there's any other way that we can gather together different aspects of our system of care and even adequately look to see if this truly is a system for the person who is passing through. But I think with an OFR, what we typically see is that the person who is moving through, touching these different systems, this is not seamless. There are gaps. There are places where we can do things better. I don't know of any other way where we can truly see those gaps and barriers than with an OFR.
This is the most important work that I've ever done. Our OFR team has become a platform for community change. And I say that because the relationships that have been built, we've been able to make change happen beyond what's related to substance use and overdose. You know, looking at handle with care and connecting police with schools. It is related to substance use and overdoses, but it's looking much more preventative. And so OFR has been able to be that platform, which makes this work so amazing and also really hard.
There is something magical about overdose fatality reviews. When you get the right people in the room, you get them to this place of sharing and trusting that I've never seen. And once they start implementing those strategies, they keep coming back because they know that this is a place that we can accomplish the reduction in overdose deaths.